To lead us in the open forum, let us welcome our moderator for this session, the President of the Association of Safety Practitioners of the Philippines, Engineer Lamberto C. De Maano Jr.
Experience and best practices. So to begin with, we would like to start with our first question with our first speaker, Dr. Yuka. So the question is coming from Cheryl Galabia. Are there any free courses in OSH that ILO is offering online? And thank you, ma'am, for the information provided to us.
Thank you very much. Good question. It depends. So yes, we provide the training to the many workers, the many workplaces through the projects, the development cooperation projects, and also the some programs of the ILO. And it's not the advertised like the training center or the training service provider. So this is usually we provide the training free of charge, but it's through the project. So I would suggest the access to the ILO Manila website. I responded to some of the question already in the Q&A box and provide the web link. So please visit the ILO Manila, or of course at the Safety and Health website at the headquarters, and they see what kind of training opportunities are available. Or we are working very closely with the OSH Center and the DOLE. So perhaps you can consult with your labor officers and the inspectors regarding what kind of availability, the opportunities available. Thank you. Back to you.
Thank you very much. For the follow-up, second question, do we still have anything health and safety related conventions not ratified by the Philippines?
Yes, so far, as I said, the almost 40 specific conventions on safety and health. And so far, the Philippines ratified the Convention 176, the safety and health in mining, and also the promotional framework on occupation safety and health, so 187. Actually, the 187 is one of the core conventions on OSH. And the OSH in mining is the very sector-specific OSH convention. And to be honest, a lot of other conventions on OSH, and we are looking forward to the further ratification. And not only ratification, the most important is application. The ratified or the non-ratified conventions, the ILO, as ILO member states, the Philippines is obligated to follow the conventions even if it's not ratified. And we are happy to provide any assistance to application. Thank you.
Okay, thank you very much, Dr. Yuka, for the information. For our second speaker, Mr. Alan Paschall, this is a question from Luis Tan. Do you extend your pandemic support programs to contractors, suppliers, service providers, and other business partners?
Yes, sir. Not only COVID support, but majority of the OSH program is being extended to our critical partners. So for COVID, we have extended our RT-PCR labs so that they can immediately test their employees, because it is a requirement from Globe to have an RT-PCR test prior going to a Globe site, so that we can protect our employees as well. So we also extended our vaccination program, COVID-19 vaccination program, and our flu vaccination program to our partners and dependents, so that we can protect them personally from the COVID virus. So there are some programs that we are extending to our partners. However, there are programs that are being implemented internally only. because due to dollar restrictions.
Okay, thank you very much for extending your services to your partners and all. For the second question from Edmundo Muncha, how often do you have outside plant employees tested for COVID-19? What about your third-party contractors? How do you require them to comply with your COVID-19 prevention program? Okay, let me repeat the question from Mr. Edmundo. How often do you have your outside plant employees tested for COVID-19? And what about your third-party contractors? How do you require them to comply with your COVID-19 prevention program? This is a question for Mr. Alan Paschall.
Ay, sorry, sir. Can you repeat the question? Sorry.
Okay, the question is, how often do you have outside plant employees tested for COVID-19? And what about your third-party contractors?
Sorry, the mandatory testing requirement is twice a month. So every 15 days, we track all of the employees who are mandated to go to our offices. We have a database and we subject them twice a month for RT-PCR testing.
Okay.
So RT-PCR testing is also needed for the voluntary return to work of our employees as well.
Okay, thank you very much, Sir Alan, for your answer. For our third speaker, Dr. Donna Bellas Davis, and the first question is from Rowena Convento. Dr. Davis, regarding the health checklist po, since we are expecting them to accomplish this with honesty, how are we going to manage those who are not telling the truth because they don't want to take absences? Doctora, this is a question from, yes, regarding the health checklist by not putting truthful information. So how do we handle this one?
Okay. With regards to the checklist, it is really very challenging to, regarding honesty of the. Oh. Hello?
Yes. Okay, medyo I think there's nagahang si Doktora. Okay, we'll proceed with the last speaker, Engineer Rosalie. So before we go again to Doktora, Engineer Rosalie, this is the first question from an anonymous participant. With the implementation of advanced robotics and artificial intelligence, how can your company manage possible human disposability issues in the workplace?
For any changes in the process, including the intervention or the in consideration of the robotic technologies, you have to go through to the same change management process. It should be customized or tailor-fitted according to the applications, where are you using it, what are the processes that it will be involved, who are the people it will be working with. Actually, it should be a tailor-fitted. There is no specific template on how you do the risk assessment on all the actions. But then the good thing is we have this basic process of change management, the risk assessment, as mentioned also by the ILO, that all these changes have to really considered inside the risk assessment, and all the stakeholders, including the employee, the worker, should be heard and considered on those discussions.
Thank you so much, Ms. Rosalie. I think change management is really is a process in dealing with this pandemic situation, especially with virtual or digital economy that we're facing right now. So for the second question for Ms. Rosalie, unemployment situation, robotics, and artificial intelligence, how do we balance and sustain social, economic, and labor situation in the country?
And for that question, actually, it's quite broad for that questions for me to answer in behalf of the company. But inside our company, we make sure that we explore all the other solutions before we really come up with this engineering solutions of inputting the robotics. So there are, as I mentioned, there are really some tasks or repetitive tasks that still persistent, the musculoskeletal disease or other risks imposed to that processes. So that is the time that we elevate our solutions to these technologies. So for the side of the policies, also I am, especially for our national policies, to really have as well our local regulations, the equivalent regulations, and how we can adopt to these emerging technologies. We cannot get rid of these changes. So it's also the right time that we consider putting up our own policy, which there are a lot actually of international policies regarding to this changes. So it's about time that we have to come up as well our legal framework, our local regulations regarding these changes in the policies for us to guide as well.
Okay, thank you very much, Ms. Rosalie, for your very truthful answer to the questions. So we're going back to Dr. Adona for the question regarding the checklist, the truthfulness of information to be included in putting all the information in the checklist.
Okay, sorry about that for being cut off. Anyway, that is really a challenge, you know. Some of the employees really don't tell the truth about telling the truth about the checklist, you know. But the problem here, the solution here is really educate all the employees about the signs and symptoms of COVID, you know, and then let them or allow them to observe their co-employees while on the job. If ever they would observe somebody or their co-employees who are not feeling well, they really should report to the clinic immediately. And right then and there, the clinic personnel will be the ones to call the attention of the particular employee para ma-check. They would be checked immediately and they will be assessed if they really are sick or not. So each and every one should be on alert that to observe their co-employees with regards to signs and symptoms of COVID.
Okay, thank you very much. In safety, we call this body-body system, but this time it's more on the integrity of our co-employees. Okay, thank you very much, Dr. Adona. For the second question for Dr. Adona. We are on work from home arrangement. How do you oblige or encourage your employees to undergo APE or annual physical examination given the fear of going out due to the pandemic?
Okay, it's really up to the employer this time. Okay, it's really up to the employer this time. There are ways on how to do annual physical examination. Maybe they could facilitate an in-study by dun na talaga sa loob ng kumpanya. There are mobile clinics already, mobile laboratories who can go inside the company and still practice. The company knows its protocols and they just have to abide it. They bring the laboratories inside the plant.
Okay, thank you very much, Dr. Adona. I think there's flexibility in doing the APE right now to prevent going to hospital because we know na maraming talagang exposed or positive or patients with possible COVID positive though. That's why there's fear of going to hospital. But again, there are mobiles health providers to conduct APE. Thank you very much, Dr. Adona. For our general questions, everybody could answer. So let me read the question. So from Edgardo Patio, good morning. With the current pandemic situation, COVID virus, where most of the employees are working from home, and we know that the working setup sometimes not complying with ergonomic safety requirements and illumination, temperature, ventilations, and sitting position. What would you recommend alternative solution to somehow prevent ergonomics related safety issue or hazard that may result to illness or injuries? So I think we could start with Dr. Yuka for the question.
Thank you very much. So that is the big issue, but actually we can improve the situation step by step. So in fact, the risk assessment is not rocket science. It's very simple and very easy way. And if we provide the appropriate training or the knowledge transfer to the workers themselves, they can conduct the very simple risk assessment and control by themselves. That's why the ILO produced a lot of checklists, action checklists. It's not the exhausted list of the checklist. It's only maximum 25, 30 checklist, very simple one, right? And actually the workers know themselves, their own hazards, their own risks, and their own health problems. So if we provide a good training and provide just a hint or the good practices to share with them, already we have a lot of good exercise, good practices. If we share those information, the workers can improve, not the expensive, not the sophisticated control measures, but just the change. For example, if the working table is very low, perhaps they can put the dictionary under the computer. It's low cost, no cost solution. So that kind of information we have to disseminate through the digital tools. So that's my contribution. Thank you.
Okay, thank you very much, Dr. Yuka. So I captured knowledge transfer and simple checklists to address the simple hazards like ergonomics. So Engineer Roy, would you like to answer the questions?
What we did was to provide resources for our employees who are working from home. As seen on my presentation earlier, we have a program called Wow at Home. We provided some ergonomic chairs, digital equipment or items that will support working from home. And we have implemented some processes that will provide a work-life balance setup for the employees. For example, every Thursday afternoon, there is meetings not allowed. So that's why we can concentrate on doing our BU work without any eye strain due to prolonged Zoom meetings. So we have in place some processes that supports the mental and physical well-being of our employees who are doing work from home.
Okay, thank you very much, Engineer Roy. Engineering approach naman sila with ergonomic chair and some scheduled processes to limit yung ergonomics hazards natin. Engineer Rosalie Payumo, would you like to give answers for the question also?
Yes, actually for that question, same with Speaker Yuka, that we really follow the knowledge transfer. So it's all about making them aware that the ergonomic hazards exist with this work from home. Everybody somewhat excited on the first days of the work from home, being with their family while working, but then this ergonomic risk exist and they try to realize that in the coming days. So as early as you try to adopt these arrangements, it's good that we do the at least the basic training. So it's also mentioned even a simple change can do a lot. Even the stretching for every 2 hours, for them, informing them about the prolonged sitting is already the new cigarette smoking because of the impact to our health. So even those information could make a change on how our employees behave or do their daily routine inside their work from home arrangements. So for me, it's still the administrative control. We call it administrative control of training the people, giving them the right information and what could they do, simple things that they could adopt inside their homes.
Okay, thank you very much, Engineer Rosalie. It's more on awareness and adoptions. Yun yung mga key takes that I've heard dun sa answer ni Engineer Rosalie. Dr. Adona?
Yes, actually I agree with Dr. Yuka and Engineer Rosalie about educating really our employees about ergonomic hazards at home, because they actually have full control of their situation now. If they know that there are risks really while doing their job at home, they should be able to correct it themselves. So it's really important to educate them.
Okay, thank you very much, Dr. Adona. It's more on full control. So our employees working from home setup have full control. They have the right knowledge, they have the right environment and flexibility, so they have the full control to address this hazard. But the key is the awareness and the transfer of knowledge to fully address or mitigate this ergonomic hazard brought about by virtual activities in our companies. Okay, let me go back some of the questions to our speakers. So for Engineer Patio, this is from Remedios Camo. Globe has provided comprehensive services and support to their employees, which is truly commendable during this time of pandemic. What are examples of the mental health services that are available to the employees 24/7? Thank you.
We have Consulta MP. It is a partner of ours that do teleconsulting services. So we have a hotline for mental health. They can call it any time of the day. It's open 24/7. And aside from the online teleconsultation, we have also scheduled trainings and awareness sessions for our employees regarding mental health. So that's how we implement our mental wellness across the organization.
Okay, thank you very much. For additional question from Ruiz. Aside from the things that Globe implemented in the midst of pandemic, we are already given or prescribed by government. What should Globe have done better or differently to improve the lives of their customers and employees?
In the context of the IATF requirements, we have complied from all of the requirements needed by the government. I think the major improvement that we need to do is to widen the reach, especially for providing the needed services. Because at the time of the pandemic, we suddenly became digital-centric, right? So the need for capacity and speed, especially for internet connectivity, is quite demanding. So we are not caught off guard when the pandemic came because we're currently doing our rollout for our fiber infrastructure. However, due to the lull time during March down to August, when the government is doing its initial response for the pandemic, that is, I think, a major improvement that we have taken is that we should have been more proactive coordinating with the government to have exemptions on our rollout so that we can provide the needed bandwidth and internet connectivity by our subscribers.
Okay, thank you very much, Engineer Roy. So because of the pandemic, we are all become techie savvy, and it requires, as mentioned by Engineer Roy, that provided needed services in terms of capacity, in terms of connections. So thank you very much, Engineer Roy. For additional questions for Dr. Belia, so this is coming from Dan Eric Maxumbol. What is the recommended frequency of COVID-19 surveillance testing for vital installation where workers regularly report at the job sites? Is the recommended frequency of COVID-19 surveillance testing?
It really all depends on the exposure. No, if they are exposed more frequently to people, example, if an employee is actually not exposed to a lot of people, they are on field work, so they don't have to have the test every so often. But if the employee, that particular employee is exposed to a lot of people, maybe like the banks or whatever employment that actually requires them to face a lot of people every day, they may be required to have mandatory testing every quarter. No, it really all depends. But some establishments do it more frequently. Okay, it depends on their exposure really.
Thank you very much. So as safety practitioner, we know that the level of exposure will give you the higher level of risk. So the impact times our likelihood or exposure will be resulted to risk. So thank you very much, Dr. Belia, for your answer. So for another question for Dr. From George Roy Kerolico. So the question is, are there other suggestions for the triangling process of health assessment, both for clients and employees entering the office premises, aside from assessment and verification accomplished manually, digitally, health declaration, and temperature checks through scan?
Okay, those really are the basic of the basic things we do in do triaging, no? And do screening of our guests and visitors when they enter the company premises. But included also in our accepting those guests should be educating them. You know, we should at least orient them our policies inside the company premises. Example, if we are so strict about wearing of masks and face shields inside the plant or company premises, we should tell them so that they would abide strictly on those policies. Because you should remember that by wearing your mask and face shields properly will actually decrease your risk of acquiring or having COVID, no? Contracting COVID from another person. So if you wear your face mask, you know, just properly wearing your face mask would really actually decrease your risk of having COVID by more than 90%. So you have to educate those guests and visitors that you are implementing such very strict protocols inside the plant premises, because that's the only thing we can do in triaging. You just take the temperature, you just let them fill out the health declaration form. That's the only things we can do. But other than that, you should inform them of your strict protocols inside so that we can protect everybody.
Okay, thank you very much, Doctora, for your answer. So it's more on orientation, additional orientation and education that is needed. Okay, so for our last speaker, I think there are few more questions. So from Art Diodano, this is a question for Ms. Rosalie. Utilizing advanced robotics and AI can be reduce mental health incidents, increase efficiency. However, it would displace workforce, which can also be a cause of stress and mental ill to workers since it would threaten their job. How do we address this situation?
Agree. For me, it will come up again boils down with the communication. With the communication, why are you doing the changes? Why are you adapting these changes? So again, in our company, we have mentioned that in our risk assessment, and even despite all the solutions that we are trying to impose, we cannot clearly or completely address some risk posed in some of our activities. That's why we come up with the solutions of this robotics technology. So with all the companies, you in order for those people not to feel that way, because we are not do not intend to really displace the workers, but rather to improve our working conditions with these technologies. So we really need to get together or get them into the change management process, involve them to have a work-centered design in order for them to really appreciate and to really understand why we are doing these solutions. It can really be a problem or a challenge, or whatever changes you can have. So again, you need to consider the perspective of the workers, even during the design stage, even before putting all these robots. You really need to hear them and involve them on all these processes.
Okay, thank you very much, Engineer Rosalie. So it needs the perspective of the workers, at the same time yung mga risk associated with the changes by putting some robotics infrastructure or process in our company. For the last question for Engineer Rosalie, what is the impact of VR or AR on risk management, considering that such tools tend to go beyond the human response and explore technology and challenges?
Okay, for the risk management for the AR/VR is, I have mentioned the potential in reliability, or we're expecting them to be reliable or to be up to date at a given time, but sometimes they are not. So the risk that could be identified during the process is how can you ensure that these technologies are the reliable ones, that what you have in place are still updated to your needs. So again, same with other technologies, machinery safety, you have to include all the standards in order to start installing them, how to maintain them, how to ensure their calibrations, their reliabilities at a given intervals. So all of this, again, I'll go back also to the legal framework, to the policies that we need to come up again for. We have now the ISO standards for individual product standards. We also have some group safety standards that could be adopted in order to ensure that instead of putting some risk to the workers or to the workplace, we sway to the advantages of these technologies, to the benefits of these technologies.
Okay, thank you very much, Engineer Rosalie. I think we have some questions that can be answered by all the speakers. So let me read the second question for all the speakers. This is from Ruel Felipe Ruiz. The question is, from the mentioned psychosocial hazards in the digital world, could you please explain those variables that have been identified as significant factor in the socio-ethical aspect of human-robotic interaction, such as emotion, user acceptance, robot autonomy in terms of communication or context? Dr. Yuka, would you like to answer the question?
Thank you very much. But before answering this question, can I add something to the previous one?
Yes, ma'am.
Thank you very much. And regarding the health monitoring of the workers, I totally agree with the Dr. Bell Davis that it should be based on the risk assessment. And the risk assessment is, of course, to assess the exposure to the hazards, in this case, the virus. But the risk assessment, the other component of the risk is the frequency of the exposure to hazards is one component. Another component is the severity of the health outcome. And it's depend on the individual workers' background, the age, and also any health problems as a basis. And also you have to think about this virus is changing, the variant. So sometimes the severity of the health outcomes may increase or reduce. So we have to think about not only the exposure, but also the severity of the COVID-19 itself. That's my intervention. And secondly, regarding the mental health, how to support the workers in this digitalized world. So I totally agree with the engineer Rosalie, and the communication is a key. And recently the study says many workers need the communication, not only the communication with the colleague or the peers, but also from the supervisors, employers and supervisor. If the workers have sense my supervisor concerned about my health, that is the very positive reaction. So always, it's not only the communication, but how about you, any problems or the health problems? So that kind of communication from the direct supervisor is very important. So now I turn to the next question. I'm sorry, would you please repeat me the question?
Yes, Doctor. I'll repeat because the question is too long, so yeah. I have to take this one again. But this is the last question from our participants. that can be answered by any one of the speaker. So let me read again the question. Good morning. As we are in our efforts of streamlining our work processes, particularly on transitioning from manual, physical to digital services for our client, what would be the most effective way of doing as of not to put much of a hassle to our clients during this transition on the management itself?
Difficult question to answer
I
to
think,
everybody, I think.
Apologies, I think this is the last one, but the first question, the second question for all the speakers is this one. From the mentioned psychosocial hazard in the digital world, could you please explain those variables that have been identified as significant factor in socio-ethical aspect of human-robot interactions such as emotion, users' acceptance, robot autonomy in terms of communication and context?
If I may, still the study is ongoing. And this is the new technology, new emerging risks, and still we don't have any good answer. And we are exposed to the transformation of the world of work, and still we are in the learning process. So what we can do is to just, understand what the human being can do and what human being cannot do, and what is the potential health outcome. But as I said, still is ongoing, and we have to watch and they catch up with the up-to-date information, the studies, researches, and they react quickly. Of course, we have to change or we have to modify the control measures later, but it is step-by-step approach. So we cannot seek the perfect solution at this point.
Thank you very much, Dr. Yuka. I think this was discussed by Engineer Rosalie. Would you like to add some clarification, information, additional answers for the question?
Yes, sir. So for this question, allow me to give like a 3A. First is acceptance. Acceptance that it is already an emerging technology. There will come really a time that there will be the proportion of these technologies could be greater. So as early as now, it serves like an eye-opener to every one of us, especially at this OSH industry, on how we can keep ourselves updated, on how can we keep ourselves informed of this upcoming changes. Definitely acceptance that there will be these changes. Second, awareness of the risk that will be involved to these changes for us to again prepare, to anticipate in terms of policy. So the third A for me is alignment. So it's not new to other countries. So there have been standards as early as 1990s to these technologies. So we can start from there and start a communication. We redo again the open communication to all the stakeholders. Also the studies and researches, which needs really to have more hands now, because again, it's going very fast on these changes. So for now, for us, for the company, the robots is to augment what we are seeing the risk in the companies. But then again, there will come a time that we will see more and more of these technologies being applied to the companies, to the processes, in order to adapt to the ever-changing, evolving world outside or inside the Philippines. So for me, for the sake of the discussion, we need to prepare. We need to prepare. We need to keep ourselves updated on these challenges and risks and everything. Thank you.
Okay, thank you very much, Engineer Rosalie, for the 3 A's. Again, acceptance, alignment, and augmentation, and preparations. We need preparations. For the last question, let me read the last question. Good morning. As we are in our efforts of streamlining our work processes, particularly in transitioning from manual to physical to digital services for our clients, what would be the most effective way of doing so as not to put too much hassle to our clients during this transition and on the management itself? Engineer Paschall, would you like to answer the question?
What we did with Globe is to do it by phases. So you cannot do digitalization in a one-time, big-time scenario because of the impact that it has to your employees and your systems, especially the budget required. So my recommendation is you do it by phases so that you can have your budget approved and then implement it across the organization seamlessly. As I mentioned in my previous slides, it is important that a culture of safety is embedded in the organization before you go digital. Because one thing that we have experienced is if the organization does not understand what occupational safety and health is all about, you would have a low turnout of compliance across the organization. So it's better to do it in phases. So phase one is awareness. You should be aligned across the organization and then slowly implement digitalization so that it will be accepted by the organization and the customers.
Okay, thank you very much, Engineer Roy. So we take it by slices, chunks, or by pieces para hindi siya overwhelm our customers and our partners. Dr. Adona, would you like to add some information regarding the question?
I really don't have enough experience with regards to these newer technologies now. So,
Yeah.
but I guess some of the problems that we are seeing now is especially in industries like mga call centers. They are being monitored by ano to, mga robot, mga ano na, no, mga monitoring mga sa computerized na talaga yung monitoring nila. So I guess yun, hindi pa masyado akong experience with regards to digitalization because we are still trying to adapt to it, no? So that's why parang what I can impart now is just what I heard and what I read about. So that's all.
Thank you very much. So I think before we end, we would like to thank, of course, our participants who posed their questions, sensible and very important questions and clarifications. So before we end, I think we still have a few minutes. I would like to get, of course, yung last message from our speakers before we end our forum. So we would like to start with Dr. Yuka for your last message to our participants.
Thank you very much for the opportunity. Yes, my takeaway is the importance of the social dialogue, because the transformation of the world of work is very quickly, and it's very difficult to follow the change. And the regulation, the law, and the compliance mechanism, practice, all is very difficult to follow. But still, we have to work. And the only way to make it happen to the dialogue between employers and workers. And we can make it through this dialogue. So that's my final intervention. Thank you very much.
Okay, thank you very much, Dr. Yuka. Engineer Roy?
Yeah, similar to Dr. Yuka, there should be a dialogue when you make occupational safety and health policies in your organization. You should have the buy-in of your employees so that when you implement, you have 100% compliance and the understanding is aligned across the organization. So similar to what Dr. Yuka said, it is important that you embed the culture of safety in the organization. It's only in that scenario that you have a safe working environment.
Thank you so much, Engineer Roy. Dr. Adona, would you like to give your last message to our participants?
Okay. I hope even if we are already doing work from home arrangements and everything, no, we will still continue with our health and wellness program. I hope our employees will support our employees, no, even if they're already at home. We should still continue implementing our health and wellness program. So maybe paano naman tayo? Maybe we can do some contest, like for example, help continue their weight loss programs and everything, even if they're already at home. Because the tendency now is really the employees really have access to all the food at home and everything. So it's really expected that they would really get fat, no? So I hope this is really a work in progress for both the employers and the employees. So we just have to meet halfway. So to make things work in this time of pandemic.
Okay, thank you very much, Dr. Adona, for your time and availability to this forum and for your last message. And for our last speaker to give her last message, imparting words. So, Engineer Rosalie.
So for me, even though my topic is more on technology, our company actually have this program, Back to Basic. So that also serves a reminder to everyone that despite this overwhelming situation of the pandemic, the emerging digital technologies, still we have to keep in our mind those basics about the risk assessment, the change management process, the training and orientation of our people that are still always up to date and we can apply at any situation you are facing. So again, we have to also keep focus on our objective. What is our objective, especially the OSH people around this webinar, these sessions? What is our objective? Why we are in the organization? So what are your inputs in terms of those changes in your company? Definitely, they will be coming. There will be those changes. You just have to anticipate, do our part in terms of our objective, our mission as OSH advocate. So thank you.
Okay, thank you very much, Engineer Rosalie, to our organizer, the OSH Center, to our participants, our OSH professionals and other partners. Thank you very much for attending and being active in our forum. Okay, this ends up our forum. Thank you, everyone, and keep safe and healthy.
Thank you very much.
Thank you.
Once again, we would like to thank our resource persons, moderator, and the participants for a very productive discussion.